Okay, so this is chapter 1 in your book. It's EMS Systems, and we're going to be discussing sort of the makeup of EMS systems, discussing the different components of them, talk about the different levels of pre-hospital providers, the different levels of hospital types. There's actually a number of different hospital types that we're going to discuss, public health, why a team approach is important in patient care, and the goals of our training. And then that's all straight out of your textbook. And then we're going to discuss stuff that is specific to the New Mexico EMS system that is not in your textbook because your textbook is written for all states. So we will discuss some things that are specific to EMS. So hopefully if you're in this class, you know sort of the answer to this one. What is EMS? Well, EMS is obviously the abbreviation is Emergency Medical Services, and what it is it's resources that are there to take care of people with life-threatening emergencies, although they're not always life-threatening emergencies, who are outside the hospital. The EMR, Emergency Medical Responder, is in many cases the first person on scene, the first trained provider, I should say, who is on scene. It's important to note that the terminology recently changed, so the class that you guys are taking and the training that you're taking is now called EMR, Emergency Medical Responder, but you will likely hear it also referred to as first responder. They're interchangeably used terms. So there are different levels of EMS care, and this is sort of a brief overview of them. EMR is the entry level, and it's about 72 or so hours of training, although some schools have a little bit more time to it than that. And it's an overview, a basic overview of many different types of emergencies that you may encounter. EMT, Emergency Medical Technician, is the next step up. It is 180 or so hours of training, typically an entire college semester, and it is basically more detailed than more detailed level of understanding is expected from EMTs than what is expected from EMRs. Obviously, they have significantly more time in the classroom and therefore a greater knowledge. And then we move on to AEMTs, or Advanced EMTs, previously known as the EMT Intermediate. So this is another college semester or so. These numbers all vary a little bit depending on the state that you're dealing with and where you are. So this is another 180 hours of training, and what this gives the person the ability to do is start IVs, deliver some medications through the IVs, and it gives them a greater number of medications and treatment options. So as you would expect, the expectation for them is an even higher level of training. Finally, the final step of the pre-hospital care ladder is the paramedic. Paramedic is over 1,000 hours of training in and of itself. So if somebody has gone through the the EMT and then the AEMT and then the paramedic, they're probably putting in close to 2 years worth of school, and it's over 1,000 hours of classroom time. Typically on top of that, there will be some clinical and field internship time. They can do everything that a AEMT and other levels can do. In addition, there's advanced airway placement, ET tubes, there's cardiac monitoring, diagnosing and treating rhythms based off of what's on the cardiac monitor, and their pharmacopoeia, the number of medications that paramedics have available to deliver to patients, is significantly greater than any previous training. So when we're discussing hospitals, there are a number of different types of hospitals. Now, some of this won't apply to New Mexico. Certainly not to a rural area like Farmington, San Juan County, and the Four Corners region, because you may not have multiple options. You have San Juan Regional, and that's pretty much where most of your people are going to go, unless, of course, you're somewhere in southern Colorado, in which case you probably still only have one or two facilities at your disposal. But you still need to understand the scope and the types of different hospitals, so you can understand if you ever, number one, get out of this sort of smaller, more rural area, and number two, so that you can have this information which may be on exams and things of that nature. So what we have are local hospitals, and these are community hospitals, they're sometimes referred to. They are not trauma designated, and there is a trauma designation, and typically it's it's a trauma level 1, 2, or 3, and level 1 is the highest level of hospital that there is. So in New Mexico, there is one level 1 trauma center, and the only trauma center in the state of New Mexico is UNM. So you need to know your local facilities. Because there are people in this class from different geographical areas, you may have different facilities in your response area, and it is your responsibility to figure out what those are and to understand what the capabilities are of each of those different facilities. There are now becoming more and more what are called specialty facilities. Cardiac centers, for example. These are facilities that have been identified as and have worked to become very good at caring for cardiac emergencies. Burn centers, same thing. There are no burn centers in New Mexico. They will take care of burn patients at UNM, but there is not a designated burn center there. Pediatric hospitals or pediatric centers. There is UNM has a children's hospital, so does a couple other hospitals in Albuquerque. And then you can see hospitals that specialize in limb salvage, in which case they probably have people there who specialize in microsurgery and nerve and vessel repair for people who have severe damage or perhaps amputation to extremities. And one thing that you will access somewhat regularly is poison control. Poison control can be reached from anywhere in the country. Their number is 1-800-222-1222. You should program that into your phone. And they can help you identify and know how to treat pretty much any type of poison that somebody has ingested. So if you ever go on a call where somebody has taken too many pills, or they have ingested an unknown substance, poison control should be one of your calls. And certainly if you don't call them by the time they get to the ER is going to be calling poison control. So although it's not often publicly acknowledged, EMS does have a role in public health. We can do things as simple as helping out at immunization drives. We can, at various levels, help administer immunizations to people who need them. And we may also be called upon to help other public health authorities in the case of some type of epidemic. If there's an epidemic, specific disease running rampant, they may ask EMS providers, including EMRs, to step in and help out. They, in this case, would be the state or the federal government. Injury prevention and education is something that we, as EMS professionals, probably don't do as well as we should. Studies show that car seats for children are installed incorrectly, something like 80% of the time. If those car seats are installed incorrectly, they don't provide the protection that they should to the child. So clearly it would be good for that car seat to be installed properly. Some departments, some departments have programs where EMRs and EMTs will be trained to install seats correctly, to inspect seats, things of that sort. I would encourage you to get involved in something like that. The other thing, bike helmet distribution, again, a pretty simple thing to do. A kid wearing a helmet is significantly less likely to find themselves head injured from a simple bike accident. And then data collection. This is something that has gotten easier over the years. All of your reports are now likely to be electronic, and that data is going to be reported to the state, which makes you actually a part of EMS research and ensuring that we are doing EMS research, which is something that we need to do in order to continue to be viewed as a profession. So when we're looking at an EMS system, there are a huge number of components, and this is not necessarily a complete list that's in front of you. There are obviously dispatch centers. In most places around the country now, they're using 911 to access an ambulance or the fire department. Some small isolated places may still be using other numbers, but whatever the case may be, there is some type of dispatch center, usually, that is going to get the call for help and will send it your way. The dispatch center will then relay that information to you, and you will respond. That's how you get your calls. Dispatchers are a pretty important part of this entire system, because without them we wouldn't have the information we need necessarily. We might not even know where and when to go for calls. Fire departments, a lot of the EMS in this country is done by fire departments. The vast majority of it, the vast majority of the land area, the geographical area anyway, is covered by volunteer fire departments. If you're in a large city or a relatively large city, you might have a paid fire department. Regardless whether volunteer or paid, fire departments are another important part of the system, and they will provide a lot of the EMS that you see out there. Some places have standalone ambulance systems. San Juan and Farmington is one of those places where the ambulance system is clearly separate from the fire department. Now, typically what's going to happen is the fire department will probably be on scene first, and they will provide some stabilization and initial assessment and initial treatment, and then they will turn over care to the ambulance service, who will transport to the hospital. People don't oftentimes see police departments as a part of the EMS system, but they truly are in a number of ways. Perhaps most importantly is they serve to keep us safe, and obviously themselves safe. So police departments are there to, number one, yes, investigate crimes, but they're also there to make sure that we're all safe and that nobody does us harm. So basically, the police are your friends, and you should treat them as such. Air medical, this is a fancy way of saying medics and nurses in helicopters or airplanes. These serve a role in EMS. If your patient needs to get to one of those specialty facilities that we talked about earlier, perhaps they need to get to a trauma center, a level 1 trauma center. Well, the only one is in Albuquerque. So what's the quickest way to get them there? It's probably to put them in an airplane and fly them there. You need to check your local protocols, talk to people in your department, your medical director, and find out if there is any standards of when you should be calling a helicopter. And then that brings us to medical direction, which is the doctor who is telling us as providers what care we should provide and when. And so your medical director or your medical direction will be writing you protocols, and your protocols are something that you should be familiar with because they tell you what to do when. That's the written protocols that your medical director will write is what's called offline medical control or standing orders. You don't need to be speaking to your medical director on the phone to find out what they would want you to do on a certain call. They will have written that out, and they will have given you, or they should have provided somewhere, or your department should have provided somewhere, your local protocols so you know what to do when. Now, protocols can't cover every single option. So there may also be what's called online medical control, where you're confronted with an issue that you're not quite sure how to deal with, your protocols didn't quite cover, or there are still some questions about it. In that case, you can bust out your cell phone or get on the radio and call your ER and ask to speak to the doctor there. When you do that, you should make sure that you know what your question is, that you're clear and concise with your information, and that you ask your medical director, the medical control physician that you're speaking with, specifically what you want from them. If you call them up and just sort of start rambling and aren't clear about what you're asking for, they're less likely to sort of trust and to give that, to approve your request. Now, that's a lot of different parts to this system. And if any of these parts don't function appropriately, the system will break. So each part is critical to the entire system. You know, if the dispatchers are asleep or not paying attention to the phones, you won't get any calls. If the fire department doesn't show up because nobody responded to the calls, you might not have the help you need on the ambulance. The police department doesn't show up, well, you could get confronted with irate people who may want to hurt you. So each part of this is important to the overall big EMS system. And they all have to work together. If they don't work well together, things will get missed and potentially patients will be harmed and maybe even providers will be hurt. So it's important that you know who you're going to be working with and what their sort of expectations and needs are from you. You are filling a role in this system, and as each part of the system is important, you need to be aware of what so you can fill it. So here's what we talked about: medical direction, online, is on the phone or on the radio, and you should be speaking to a physician. You should not be getting this stuff relayed through a nurse or an ER tech or something of the sort. If you want online medical control, you should be speaking to the physician. Written protocols is offline medical control. And when you get to your department, when you're done with this class, or even perhaps before you're done with this class, you should ask to see what your written protocols are so you understand what you're getting into. And you sort of, as you're going through this class and you're seeing disease processes and various things happening, you can sort of relate that back to that you've already looked at. The medical director also has some other responsibility, not just writing treatment protocols, but they also have to do what's called QA and QI, quality assurance and quality improvement. And that is them making sure that your care and everybody else in your department's care is appropriate. And then they also have to ensure that you keep your education up, because medical care, particularly pre-hospital medical care, is changing very rapidly. And if you get out of this class and say, well, I've got my cert, I've got my license, I'm good for 2 years, and you don't pay any attention to any changes between now and 2 years, you're going to miss something. And so it's important that not only is it your medical director's responsibility, but it's your responsibility as well to ensure that you stay on top of things and keep your current. So, transportation. There's different forms of transportation, but what they boil down to is getting the patient to definitive care. Definitive care is the care that is needed to solve the patient's problem once and for all. It's not about stabilizing the patient necessarily. It's not about, maintaining the patient. Definitive care is about fixing the problem, whatever that may be. Oftentimes it's surgery. Sometimes it's a specialist. Very rarely is definitive care in the pre-hospital environment, which is why our role is to get people to the hospital, because that's where definitive care is. And there are different ways you can do this. The book just breaks it down into prompt transport and rapid transport. Prompt transport is a patient who needs care quickly, and that's pretty much the catch-all. Everybody sort of falls into that category, except for people who fall into rapid transport category. And that is defined in your book as people who will die without immediate care. And when you get into assessment and when you get into doing scenarios, there will be discussion of which is which and when each one should be utilized. So here are your responsibilities. You need to make sure that your equipment is ready to go. Whether it's your own jump bag, whether it's a truck, whatever the case may be, It is your responsibility to ensure that you have what you need, that you know where it is, and that you're ready to use it when need be. It's no good. It's no good to show up on a call with a jump kit that is empty or with a first out bag that you haven't looked at. So you go to open it up and you don't know where anything is, or you're missing a critical piece. So it's important that you have your stuff ready to go. You'll hear this called checking your truck. In the real world, if you don't check your truck and you find that you need something, a glucometer, to check a blood sugar, and you don't have it, well, you can't check a blood sugar. So get in the habit of checking all your equipment. And then get to the call safely. When you first get out there, you may get excited about what sounds like a good quote-unquote call. A rollover, or somebody who's been ejected, or a gnarly medical call, or whatever. Your first responsibility is to ensure that you get there safely and don't hurt anybody on the way. A lot of people get their lights, siren, their ability to use them, and they sort of go a little bit crazy with them, and they kind of forget how to drive. When you're driving a truck or a car or whatever with lights and sirens, it is not a passport for you to just drive however fast you want and blow through stop signs and all of that kind of stuff. You're still on the road, and you need to drive incredibly defensively to ensure that you get there safely, because people will see your lights, perhaps, and they will siren, again, perhaps, and you never know what they're going to do. So always drive incredibly defensively. Ensure that you give people plenty of room to do, the silliest thing you can come up with: slam on their brakes, pull to the left, pull to the right, throw it in reverse, whatever, and make sure you get there safely. Once you're there, you need to assess your patient and provide good quality care, and then get them safe transport. So the flip side of responding safely is we need to get them safely to the appropriate facility. And then once we get there, we're not quite done yet. We've got to ensure that we give a turnover of care report to either the transporting agency, if you're a two-tier system where somebody else is going to transport the patient, or to the receiving facility. So we've got to make sure that we don't just dump the patient off in the hallway. We turn the patient over to a nurse or somebody else in the ER who is at the same level or higher level of training than you are, and we give them a little bit of a story of what happened with the patient, what their chief complaint is, what we found, and what we did for them. And then, as the job says, as the saying goes, the job's not done until the paperwork's done. So this is when you would begin your documentation, or you would complete your documentation and ensure that whatever your reporting requirements are met. Also, on top of all of that, this is stuff that happens outside of the call. You need to keep up on your training and education. Now, even if you are lucky enough to work for a department that will provide you with training and education, it's still your responsibility to make sure you have what you need when it comes time to renew your license. It doesn't work for you to say to the state, well, you've got to renew anyway because my department said that they would provide education and your department didn't for whatever reason. So make sure that you've got the training, that you've got the education that you need to renew your license. And then health and well-being, and we'll talk about this more. But bottom line is, if you are not healthy, and I'm talking mentally and physically healthy, you are a liability on a scene as opposed to an asset. So make sure that you do whatever needs to be done to take care of your mental and physical health. Different things work for different people. For some reason, for some people, it may be going and working on the farm or on the ranch. For others, it may be playing sports. Whatever the case may be, figure out a way that you can keep yourself in good mental and physical health, and then the equipment and supplies for more than just your personal jump kit or for your personal first out bag. You are also partially responsible for taking care of that. Okay, so let's talk about the different levels of EMS providers. At the national level, and New Mexico follows this as well, at the national level there are 4 levels of EMS providers. The EMR, which is the course you're in, the emergency medical technician, the advanced emergency medical technician, and the paramedic. Now, New Mexico follows the national naming and the levels of licensure, but New Mexico EMRs and in fact New Mexico providers at all levels are allowed to do more than the national level. So it's important for you to note that throughout this course you will be seeing stuff that you're allowed to do as an EMR in New Mexico, but because it is not in the national standards for EMRs, you will not see that information on the test. And your instructor will point out where that discrepancy arises. For the most part, that's going to be something that you're going to see in the pharmacology section when we're dealing with medications. EMRs in New Mexico can give more medications than EMRs at the national level can give. So now we're going to get into discussing some New Mexico specific EMS issues. The state is currently divided into 3 regions, Region 1, 2, and 3. And the headquarters of each region is listed there. Region 1 is Santa Fe, and it's sort of the north, central, and west portion of the state. The Region 2 office is down in Las Cruces, and it's sort of the southwest portion of the state. And Region 3 is Clovis, and the Clovis is the southeast, but it also goes all the way up to the northeast portion of the state. So basically you could just call it the eastern half of the state is Region 3. The regional offices put on conferences. There's 3 conferences in New Mexico every year, 1 in each region. And they will also be a resource for you to find continuing education credits, which you're going to need to renew your license every 2 years. So the regional offices can be good resources for you going into your career. Another important organization that you need to know about is the EMS Bureau, which is a part of the Department of Health. And they are responsible for licensing and testing, which they have contracted with the National Registry of EMTs to do all of that. And so all of the tests you take for the state will be now National Registry tests. The National Registry is an organization that provides testing and certification for a number of states around the country. I believe it's up to 47, and New Mexico is obviously one of those states. And the EMS Bureau also puts out the regulations, the scope of practice being perhaps the most important of those regulations. The scope of practice outlines what each level of provider is allowed to do in New Mexico. And so your medical director can limit what you're allowed to do. Your medical director can say, for whatever reason, they don't want you to be giving aspirin. It would be a strange thing for them to say, but just as an example. And even though the scope says you can give aspirin, if your medical director doesn't want you to give aspirin, you will not be allowed to do it. Then we have the regional offices, which we discussed a little bit, and there's also something that you can be involved in called a special skill application. And actually, up where you are in San Juan, they had one of the perhaps most successful special skill applications there several years ago, where they applied for and got approved to allow, I believe it was at the time, EMT Basics, now EMTs, to put in airways called LMAs, laryngeal mask airways. And as a result of sort of that special skill application, which was approved, and everything that grew out of that, the scope for the entire state expanded, and everybody at all levels now has the ability to put in LMAs. So the regional offices can help you with skill applications, special skill applications, and they can also help you find education opportunities. So let's talk about your licensing. This is something that I can't stress this enough. It is on you. You must figure this out. You must do this. If you have questions, speak to your instructor, and I'm sure they'll be happy to help you answer them, but this is your responsibility. You need to go to nremt.org, and you'll follow the instructions on that site to create an account, a student account, and which will then turn into what you need to take the test. The test will be done, and then we'll go to the state, who will help you with who will get you your license, and all of this must happen within 9 months of this course ending. I would strongly urge you to do it as soon as possible after the course, because it is very clear that the longer people wait, the greater the chance that they will not be successful on the licensing exam. So don't wait. Do this as soon as possible after your course to make sure that you have the best possible passing the test and getting your license. So once you've gotten your NREMT EMR license, actually it'll be a certification from them, you will also have a pink bubble sheet, one of the infamous pink bubble sheets from the EMS Bureau, which your instructor will provide to you. You will need to send that to the State EMS Bureau. You will need to send a copy of your current CPR card, which has to be current, and it has to be the appropriate kind. It has to be AHA Healthcare Provider, or there are a few other options that the Bureau will also accept. And you send them, I don't believe they'll accept a check, so send them money order for $25 for the cost of your license. They will get all that, review it, make sure it's complete, send you out a New Mexico EMR license. To renew that, you need to have the appropriate renewal application. The state will not send this to you. You may get a postcard from them telling you that you're up for renewal, but it is incumbent on you as an EMS professional to find the paperwork you need, fill it out, get an original signature from you and if medical director if necessary, and send that along with the appropriate fees. And you've got to have 24 hours of continuing education. Your 24 hours of continuing education have to be approved by the Bureau. You can't go to, Uncle Billy Bob's trauma assessment and get credit for it. So anything you take at a conference, most of the training that is done through your department, or anything that's taken at the college, will most likely be Bureau approved. Again, if there are any questions about that, you need to speak to your local regional office or check with somebody who has more experience in this. Along with those two things, you will send in your CPR card again, and a check, or again, a money order. One more thing to note is the Bureau currently does not want you to send in copies of your CE hours, so you don't have to send in the course completion certificates or anything of that nature. However, the Bureau will randomly audit, I think their current standard is 10% of their renewal applications. And you may send in your form and you've filled out all the paperwork appropriately, and you get back a card from the Bureau saying you're being audited. At that point, you need to have all of the paperwork to back up the claims you made on the application, the renewal application, and the Bureau will want to see it, so you send it in to them. If you don't have it, you claimed you had it, you're in trouble. You're likely to get your license revoked, suspended, something of the sort. So just make sure you have, over 2 years, 24 hours of Bureau-approved CEs, and you won't even have to deal with it. You put it in a drawer somewhere, you keep it until you've got your new card, and keep it even longer, so in case they do come back and audit you at some point for whatever reason, you've got backup in the validation. So, once all of that is done, you get your license, you get your cert. It's good for 27 months. All of the continuing education and renewal requirements, however, have to be done in the first 2 years. So your license will expire March 31st of whatever year, probably 2014 for you guys. So your license will expire March 31st. Everybody's license expires March 31st. So everybody renews every 2 years. However, the CE requirements for you is 24 hours of CEs must be completed by December 31st of the previous year. So if your license expires 2014, you must have everything done by December 31st, 2013. If you don't, there is a path to renewal, but it's really expensive and it's a pain in the butt, so don't even go there. You got 24 hours of CE credits that you need. Get them done by the end of year 2 of your license, and you'll be fine. So just make sure you have that stuff done. You'll start seeing at the end of every year, as it gets into September, October, November, schools will be offering last chance refreshers for all of the procrastinators. And you don't want to put it to last minute. You're going to work hard enough to get this, make it easy to retain it. Now, there is a difference between a certificate and a license. A certificate is something that's issued by an educational institution, a college perhaps, that says, yep, this person completed the EMR class. Some states are certificate states where a certificate like that is enough for a person to practice. New Mexico is not a certificate state, it's a license state. So New Mexico will issue you a license. A certificate, yeah, okay, you can frame it, put it on your wall, it'll look nice, but it doesn't allow you to practice as an EMR. That needs to be very clear. You can pass this course, you can get straight A's in this course, you will get a course completion certificate if you do those two things. But if you do not take the state or the National Registry licensing exam, that certificate does not allow you to do anything to function in any way as an EMR. What you need is a license. There's a number of benefits to you having a license. It allows you to practice in New Mexico with supervision. It is also property. It's yours. And a license is different from a certificate in that the license is property, which means nobody can take it away from you. The Constitution provides certain protections to property in the United States. So once you have that license as property, it's yours. And that means it can't be taken away from you without due process, which is pretty steep for them to come in and take your EMR license or any other type of license away. And finally, the license is officially the state of New Mexico saying, yep, this person met our standards, and they know what they're doing, and we're okay with them out there practicing medicine. So, although there are a few more hoops to jump through as a licensed state, we should, as a profession, be happy, actually, that we're a licensed state, because it's sort of a higher level of professionalism than somebody who just has a certificate. So, that's the presentation. If you have any questions, direct them to your instructor, and I'm sure they'll be happy to answer them for you.